diagnosed diabetes, cardiovascular health challenges, patients looking to train for a sport. And a lot of people are now on GLP-1, so helping them manage through some of the symptoms and side effects of that medication as well. And I'm based in Arlington, Virginia.
Awesome. Thanks so much, Jessica. Renu, can you go next, please?
Sure. Hi, I'm Dr. Renu Mansukhani. I'm an endocrinologist. And so that means, again, I'm a hormone specialist. But I have subspecialized in the field of obesity medicine for, believe it or not, 18 years. I have worked in many arenas, but in the beginning of my career, I was involved in various iterations of a multidisciplinary practice, which is sort of like the gold standard for helping people with weight management, meaning similar to the team we have before us today, we had psychologists, we had trainers, we had dietitians and physicians working together. I went out on my own about 9 years ago now. So now I'm in solo practice and I kind of wear all the hats, but I still refer out to my trusted colleagues here. And for me, it's interesting. I've always, and what's one interesting thing I like, just tidbit I like people to know about GLP-1s is they're not the only medication we actually have to use as a tool in helping people manage their weight. And obesity is a metabolic medical problem, basically. It's not just a matter of, calories in, calories out. And so, again, having done this for 18 years, we've always had FDA-approved medications that are safe and effective for weight management. It's just the GLP-1s have kind of popped out onto the scene in the last couple of years, and that's what everyone talks about. And they're very good medications. But there's a lot of tools out there for people to take advantage of.
Awesome. Thank you so much, Renu. And last but not least, Cole, can you please introduce yourself?
Yeah. Hi, everyone. My name is Cole Mercer, and I'm the fitness director at Method. So first, I wanted to thank everybody, including Aiden, for putting this on for us and getting Renu and Jessica to be panelists. We're pretty excited about the topic and what we have to discuss today. As far as what my specialty is, I am the fitness director at Method. And my background is kind of multidisciplinary. I started out kind of thinking I was going to be an engineer. I decided I was going to be a chemist. And then another 6 or 7 years later, I decided I was going to be a trainer when when my hobby of fitness sort of became the all-consuming thing in my life. So I approach a lot of the training with a scientific mind, more centered around the biochemistry setting. I understand the biomechanics piece of it all, but I really have always appreciated the metabolic piece of conditioning and of strength training. And so I bring that a lot to the training at Method Fitness. With respect to my expertise, I wouldn't say that I'm any sort of expert on GLP-1s, except the fact that some of my clients do, many of our clients at Method Fitness utilize GLP-1s. And so what we've learned how to do is manage the expectations with respect to what training looks like on GLP-1s, the types of things people can and maybe should avoid. But most of it is centered around listening to experts like the panelists we have here today. So I'll give my 2 cents towards the end, but a lot of it is just going to be listening to Jessica and Dr. Mansukhani today. So
Awesome. Thank you so much, Cole. So I'm going to walk us through a bit of how the structure of today's webinar is going to go. So first things first, in regards to just Zoom etiquette, of course, we'll ask everyone to please keep their mics muted. You can feel free to have the option of having your camera on or off, of course, but feel free to enter in questions in the chat as we go on throughout our conversation for today. For the first segment, we're going to be having some quick discussions with each of the panelists for about maybe 10 minutes or so. I'll be asking some leading questions, some questions that you may have submitted in your survey as well. And then from there, we'll go into a large Q&A with the whole audience and our panelists as well, where you can ask any free question that you would like. So first, we will actually go with Renu, with a goal of trying to build more foundational understanding of GLP-1s are. So first things first, I'm gonna actually have a Renu, you start. We're actually gonna ask a quick question about just exactly what are GLP-1 medications and how do they work in the body?
So GLP-1 medications are basically medications that mimic a hormone that we naturally make called GLP-1. Um, and what that hormone does is it acts on receptors, so GLP-1 receptors that we have all over our body. We have them in our brain, we have them in our gut system, so in your stomach and your intestines and in your pancreas. And so because they act on all those different locations, they kind of have numerous different effects. In the brain, and again, this is not across the board, but many people find that it makes them a little less interested in food. It regulates their appetite. Maybe they have less cravings. Some people even have less thirst, which can be a problem. But it turns down, many people have heard of the term food noise. It tends to, for a lot of people who have a lot of thinking, that causes them a great deal of stress because they're thinking about food more than the average person. It can turn down that sensation. But in the body, otherwise, these meds were originally created for diabetics because they really help regulate your blood sugar. In the pancreas, this hormone causes your pancreas makes insulin, which helps deal with blood sugar when we all eat carbs and it digests down into blood sugar. And so GLP-1s I describe them very interestingly. I sort of say they make your insulin secretion more efficient, basically. And so people's blood sugars tend to be lower on average, again, which is good for diabetics and even people who don't have diabetes. As a result of the insulin working more efficiently, you make less insulin overall throughout the day, which is good because insulin is in addition to regulating your blood sugar, more insulin we make, the more fat we tend to store. So it tends to cause people to store less fat, and that helps with weight loss. And the third prong is because it affects your stomach and your gut directly and slows gut digestion, people tend to be full sooner, tend to eat less, and that sort of thing. So that's sort of, they work on multiple levels.
Awesome. Thanks so much for sharing that whole background. Since GLP-1s have been entered more into the market, how have you found it's affected your line of work with your patients?
It's a really interesting question. So again, I've been in this business for a really long time. And so, people, and my approach just generally to weight management and obesity is very holistic. Like it's not like people come in and they say, I need help with my weight. And I'm like, here's a prescription. That's not how I work, right? I do a very extensive intake. We talk about all aspects of patients' lives, from their stress levels to their mood, to their eating habits, to their, movement habits. All of it kind of comes together. And then we kind of make a global plan addressing little tweaks they might make in each arena of their lives as it affects their ability to manage their weight and frankly, just feel good and be healthy. But interestingly, and medications, again, have always been part of the repertoire because, again, this is a metabolic problem. And, one thing that makes me happy in a way that these meds have taken such a forefront is that I think in the past, people would feel if they couldn't manage this problem with just lifestyle, it was a failure on their part somehow. And it was sort of a failure to have to use a medication, but that's not the case at all. You're just managing a medical problem that happens to have a lifestyle component, but it's also just a metabolic disease that some people have and some people don't. And so, again, I've always used medications, but what's different now is that people come in asking for these medications by name, right? Which is kind of a new thing. Before, I think people just didn't know that there were meds out there, and I would go through pros and cons of various med options. But I will say, interestingly, they have this subset of medications has really taken over as the most prominent medication I prescribe. I will say the most common type of medication I use, just because they're so well known. And frankly, I mean, be honestly, they have been game changers in that they are not effective for everybody, but they are more effective than anything we've had before. And so for a lot of people, they can be a good tool. But again, not for everyone. Pros, cons, risks, side effects is something we discuss.
It's actually really interesting to hear you say that it hasn't been effective for everyone. Is there a certain demographic that tends to benefit the most from GLP-1s? And also, like, what are some important considerations that people should be aware of when they consider taking it too?
That's a good question. Gosh, if I had a magic crystal ball to say this is going to be the med for you, versus not. I mean, how I sort of frame it for folks, I'm like, look, these meds are all obviously extensively studied, right? And when you hear the headlines, on the news or what have you, or social media, these meds work for everyone. These meds, everybody loses, whatever X, 10 to 20% of their body weight. there's always a bell curve, right? There's always out of 100 people who take any medication for any reason, frankly, but talking about this case in particular, I always tell people, look, of 100 people, maybe 20 people will have, a very good effect. Some, the middle might have a, medium type effect, and then there might be another 20 people that it just doesn't work. And there are some studies going on, and there is some genetic data that there probably is some difference genetically in people for whom these meds do and don't work for, and for people who are super responders, as I call them, versus people who, I have people who come into me very frustrated, or we try it and they're like, it didn't work for me. What's wrong with me? And I always say, look, there's nothing wrong with you. Your body just may not be as reactive to this particular medication, just like some people need one aspirin and some people need two, or some people Tylenol works better, or et cetera. Like, we're just different in the way we respond. And I don't think we have enough data yet to identify people who would be a better responder or not. But things people should consider when they do consider taking these meds is, frankly, the main side effects often are stomach upset and GI issues, right? And so if you already have GI issues at baseline that are pretty sensitive, whether you have gastro reflux or diarrhea or constipation, not that you couldn't take these meds at all, but it's just something to be aware of. And I would think twice. Or if you have known pancreas problems, if you have known thyroid cancer, a very specific type of thyroid cancer in your family, you're not supposed to take them. But you just have to have a good provider who can talk pros and cons with you.
Great. Okay. You were talking about a lot about how the data that's coming in is still kind of like slowly kind of changing the landscape of how GLP-1s are seen and how they're affected. Is In your profession, is the research something that you kind of have to really keep up with to kind of like see how it affects a ton of like your clients that you interact with?
Absolutely. And it's interesting. I was just saying to someone else, it is, even for me, and I do this day in and day out every single day, it's a little overwhelming, right? Like, how fast the news is changing, how fast we're getting new medications. Literally today, there's 2 to 3 meds in the pipeline that are probably going to come out in the next year, just a year and a half. And then there's like 6 to 8 more meds sort of in the similar kind of class behind them, 5 to 10 years out, right? So just keeping up with what meds are coming out, the slight differences and nuances between them, of which there are significant ones. And then, like you said, the ongoing studies about benefits, like, certain different GLP-1 type medications are better for a different cohort of patients. For example, people with sleep apnea, it might be more beneficial to take a particular one, like Zepbound or Mounjaro. Other ones are, and so there's heart benefits, there's, and then more risks, small risks, but tiny risks are coming out as well. And they keep updating the labeling regarding hair loss and maybe some eye problems. So it's a lot to keep up with, actually. And even, like I said, I do this day in and out, but you have to really be on it.
Yeah, I have another client actually who's also a medical professional as well, and she has continuously told me about like how she's always having to like keep up to date with the research that is coming out, and it sounds exhausting as you said.
We try, but you have to, right? I'm sure you guys keep up in your fields as well, right? But you have to. You have no choice.
Yeah. My last question for you before we move on to our next panelist is we have some individuals here uh, on the webinar who are listening and watching, and they themselves may not be interested in taking a GLP-1, but they may know someone who is. Is there anything that you want to tell them per se on like when it comes to having a conversation with a relative, a friend, a coworker, things in that regard?
Yeah, I would say, obviously just listen, right? If someone brings up the fact that they're on the GLP-1, don't judge. Again, it's just a medication that they're using because they feel it will hopefully help them feel better in some way, whether it's with their health or, whatever, or their outlook. And just sort of, again, kind of be as supportive as you can, sort of thing. Again, there's no judgment in taking these meds. They may not be, if you're, eating with somebody in a setting that they happen to be on a GLP-1, they may not be able to, and obviously I'm sure the other panelists will get into this, but they may not be able to eat as much as you might normally expect them to eat, perhaps, right? Because they're going to be full sooner, their portion sizes are likely going to be smaller. And so it can be kind of awkward if a family member or well-meaning loved one is like, you're not going to finish that, or, kind of call them out on it. It's not, it's just kind of, obviously just try to be sensitive and just appreciate the fact that their eating habits and what they're doing in front of you may be different than their norm. They may not be drinking as much. whatever, and just try to enjoy their company and sort of just let them do their thing. I think that's what I would say.
Thanks so much for sharing that message. I think it's really important to know how to also support someone who is
Mhm.
considering or is currently taking a GLP-1 as well. Thank you
Mhm.
so much for your time, Renu.
Sure.
Um,
Happy. Yeah.
I'm going to move on to Jessica next here, kind of talking a bit more about the intersectionality with nutrition and GLP-1s. So my first question for you, Jessica, actually is going to be regarding how has your landscape changed with the introduction of GLP-1s? I'm sure you have lots of clients who are taking it or considering taking it. Can you bring us a bit more into the depth and the insight into how nutrition has been affected while someone is on a GLP-1?
Yeah, I think it's really interesting that we now have this tool available to these patients that in the past, they were hyper focusing on calorie restriction and macros and not getting results, and like Renu said, like felt like they were to blame for not being able to achieve some of their goals. And so being able to add this tool in has given them a boost of motivation so that they are seeing progress when while they're doing making all these nutrition modifications in conjunction, and seeing the progress. That being said, with the side effects that can come along with these medications, we're talking a lot more about really making sure that we're hydrating enough, really making sure that we're getting enough fiber to help keep food moving through the system, protein to help prevent muscle loss, because as we lose weight, there's always going to be a little bit of muscle loss that happens, but we really want the majority of it to be body fat. But unfortunately, if we're not getting enough protein and doing strength training in conjunction, we do see more muscle loss because there's such a calorie deficit with people that have a decrease in appetite. And so really focusing on making sure we're fueling those muscles and preventing or decreasing muscle loss as much as possible. And then also, because the patients are taking in less food, we need to make sure that they're getting the nutrients they need even from the less food. So, making sure they're getting enough vitamin B12, iron, omega-3 fatty acids, and those types of things, and magnesium, are usually kind of nutrients that sometimes can decrease. And so I try to help them get it from food first before supplementation, just because our body absorbs it most efficiently from food. But there can be conversations about if they're really not able to get it from food, or if they aren't eating. I do have a couple patients that are on GLP-1s that are vegetarians or vegans, and so protein can be more challenging, and so that is where sometimes some supplementation can be helpful.
Awesome. Thank you for sharing that. I find it extremely interesting that when Rainey was just talking about how like individualized the experience can be on a GLP-1s. I'm sure in your field and in your scope, you have a lot of instances where individuals are having different responses to it, different experiences with it, of course. So how are you changing the mindset and the perspective around like satiation, around like hunger, around like those nutrition habits, because it's a lot that they have to shift. I imagine. How are you kind of shaping that like mental landscape of it too?
Yeah, so it's interesting because with patients that are not on GLP-1s, we talk about hunger satiety, really honing into understanding and learning when the body is hungry and not waiting till we're too hungry, and then stopping eating when our body is full and not getting to be too full. And that's a really, I think, important part that I work on with those patients. The patients that are on GLP-1s, I would say a lot of them, not all, because again, this is not, everybody's body responds differently to these medications, but a lot of them have, satiety and fullness changes from the medications. Their digestion is slower. These hormones are sending the fullness signals to the brain quite differently than when people that are not taking it. And so, so talking about shifting from focus, hunger to making sure that they're eating on a schedule so that they are still fueling their bodies, getting enough energy and nutrients, because some of these patients, they have the hunger signals have just disappeared for them, and so they have to get themselves, and we work together on goal setting, making sure that they're not skipping meals, making sure that they are getting enough protein and fiber to make the weight loss, number one, safe and at a good rate, and then make sure that the weight loss is mostly body fat versus losing muscle mass. And it's interesting, a lot of these patients, they definitely have an increased thirst. So they're kind of naturally getting, they're at least being signaled to get more water. So that's kind of a good thing of the side effects, is that a lot of them are naturally being signaled to want to drink more water. So that's helping them get more water. And
Awesome. Thanks for sharing that. My next question for you, Jessica, actually is one I was actually myself super excited to like hear about. But when it comes to like you getting a client that's interested in taking a GLP-1, what are the biggest like nutritional challenges or maybe even misconceptions that they may hold when it comes to taking a GLP-1s?
yeah, so not eating enough total. Again, their appetite sometimes, signals are sometimes just not working. And so a lot of them are under fueling, and especially if they are exercising, we want to make sure that they are fueling enough to be exercising safely and not putting them at risk for injury. So under eating is a big one. Not drinking enough fluids. Relying on convenience foods or processed foods. A lot of them, if there's some GI discomfort and sometimes there's some nausea, they don't want to eat, some of the foods that they would previously have eaten, and they just don't have the interest in food. And so they would rather just, eat a protein chip because they think that's going to get the protein in. And while it will get the protein in, it's a processed food. And so I try to work with them to get as much whole food in as possible. And whether that is in smoothie form, small frequent meals can also be really helpful so that they don't feel overwhelmed with eating a full meal in front of them, but the smaller, more frequent meals helps them to digest that more. And so, whereas, in the past, they might have had 6 ounces of chicken, we might break that up into 2 or 3 meals, at least to not overwhelm their GI system, but still to get that protein into the body. And then I do have some patients that automatically think that they've got to, add the supplements in. And not that I'm against supplements, but, I think it needs to be discussed with your doctor, and then also, if possible, with a dietitian, to see what are you eating and where is there a nutrition deficiency, so that you're not taking something unnecessarily. Because again, our bodies absorb the nutrients so much better from food than from a supplement.
Hmm. That's a really and interesting. Thank you. When it comes to like the same quick question that I gave Renu too, is there a final like kind of message that you kind of really want to drive home to the people who are listening and watching? I really love to kind of bring this kind of like this biggest takeaway piece at the very start of a panel, because I want people, if they could take one thing away, what is it that they should like know or understand? Do you have a final message on that?
Yeah, I mean, I think, I hate that protein is such like the hot word in our society right now, but for people that are on GLP-1s, making sure they're prioritizing protein first when possible, again, to really help manage muscle or prevent muscle loss. And then, sorry, I just saw a question popped up. Is protein powder and smoothies a food or a supplement in terms of how the body absorbs it? So that's a great question. I like to think of protein powder. So there's a lot of different protein powders out there, first and foremost, trying to find one that has the least amount of artificial sweeteners in it, and that your body responds to well is, I think, really helpful and important. I try to look at protein powder as a supplement. We do want to try to get as much protein from whole foods when possible. And then to supplement with the protein powder, I think is really helpful for a lot of people, especially that are taking GLP-1s. There's natural ways that we can get protein in addition to protein powder in our smoothies. Greek yogurt is a really great option. Gives you calcium, gives you protein, vitamin D. So that's a great way to add it in. Ground flaxseed is also, and chia seed also can add a little bit of protein in there too. So we don't have to solely rely on the protein powder. We can get some whole foods in there with the smoothies as well.
Awesome.
But sorry, going back to kind of like biggest takeaway, protein first, drink your water, please, 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 because it really, anything we can do to try to manage the digestion and prevent constipation in these patients, I think is really important. And I always tell my patients that come and talk to me about some of their side effects, if you're having consistent side effects, please talk to your prescribing doctor because they should know. Yes, they should know what's going on. If it's like, one day constipation, but then it goes away, like we don't need to sound the red, the alarm, but your prescribing doctor should know what's going on. There, like Renu said, there are different medications that different people react to differently. And so just because one GLP might not be kind of working well with you, the doctor can help you figure out what is the best solution to the problems or the challenges that you're having.
Awesome. Thanks so much, Jessica. Thank you for sharing all that information. All right, and last here we'll have Cole go. Cole, I'm going to kind of start having you discuss more of the intersection of GLP-1s and physical outcomes as well. So, first question, one quick question I wanted to ask you is that with clients coming to you informing you that they're taking GLP-1s, how has it been in your training scope been affected by that information? Does much happen or does much change with your personal training programming for clients and things in that regard?
It's a really good question. I think when a client is first coming up to us and letting us know that they're on these medications, the first thing that we do is ask how recent, or at least the first thing I do is ask how recent they had started. The effects can I've noticed that with some clients who take it, the side effects can sort of stabilize after a certain point. And so as they either change a dosage or hop onto the medication at the first time, the onset of those symptoms is more severe. So I'm monitoring it more consistently. Whereas like as they begin to just kind of settle into that dosage, or they found the exact medication that works best for them, they sort of stop letting me know about the side effects. And so the probing itself sort of just dissipates. And then I will occasionally check in and sort of just ensure that, like, hey, has the medication changed recently, or how has it been working with you? Because it sort of just goes on autopilot for the clients as well, at least from our perspective. But with respect to if anything changes from a programming perspective, not really. The thing that I like to imagine with respect to training is that our needs vary in magnitude, not in kind. So we all should be doing relatively the same things. We should be strength training and ensuring that we're loading our spine vertically. We should be creating shearing and rotational forces in the body, and we need to be ensuring that muscle is constantly being taxed for a number of reasons, some related to GLP-1s and for a number of other reasons related to bone health and metabolic health. But it means that I might scale down when somebody is going to be exposed to potential symptoms. If they're having GI issues during that particular day, we're obviously not going to be squatting real heavy or doing anything that's going to create a potential gastric problem. We may just be a little bit more of a recovery day. So this is, if there's one takeaway, I'll kind of jump forward on the question that you're probably going to ask. Is one takeaway is that with whatever you are comfortable with, if you are working with the trainer or if you're working with us, I highly encourage you to share your medication, at least the cycling of it or the changing of dosage with your trainer, so that they're aware of these things if something were to occur. There are side effects that are more severe than just some of the gastric issues, and so us knowing about it ahead of time could potentially help in a not in emergency scenarios, unlikely, but just in scenarios where you are more likely to feel worse. And we can sort of triangulate that information with how we should adjust the day to day.
Awesome. Yeah. Thanks for the great introduction with that, Cole. I think it's really important to especially kind of discuss a lot of the I guess the transparency with taking GLP-1s too, because with all of you, it affects your field and scope quite intensely, especially on the personal training side. I'm sure that some people may have the concern that, oh, if I share this information, my programming might change and my goals might change too. I want to ask, what happens to muscle mass as someone is on a GLP-1?
Yeah, so it was referred to briefly earlier by the others, but there is always a muscle wasting effect of anything that creates a caloric deficit of any type, just like Jessica mentioned earlier as well. And so the muscle wasting effect is one of the biggest limiters to GLP-1s in terms of long-term usage. And so almost certainly the prescription of increased protein intake while simultaneously creating some form of muscle stimulus through tension is going to be the prescription for making sure that that is not the case. So this particular effect we call sarcopenia, which is sarcopenia is age-related muscle loss, but it's becoming more broad in terms of just muscle loss in general because it can happen from multiple sources. And so that muscle loss comes through and affects training in ways that have a multitude of other negative effects. So as far as the client coming through with starting to notice muscle wasting effects, we're going to notice that numbers are going to start changing. So we can actually see the output. So the input isn't our responsibility. However, the output is what we are tracking. And so as far as what the client is doing and how they're performing, if we start to notice some of those changing over time, we can start to make a note of maybe you're not eating enough. Maybe you're not eating enough protein. Maybe you should talk to a dietitian or your doctor, because those numbers could theoretically be at least stable. With the way that strength training works, or at least here at Method, the way that we really focus it is that we're looking at applying force to the body in increasing increments, very small marginal gains over time. You start about 5 pounds today, we add 2.5 or 5 pounds the next time, we add 2.5 or 5 pounds the next time. It's something called linear periodization. By doing so, we're able to accumulate these small amounts of tension, small amounts of forces that give the body signals that it should be continuing to put on muscle. But if you're not doing any of that, it gets none of those signals, and that tension piece and also the muscle loss piece creates creates a big change in quality of life over time. So I think I went on a tangent there. Did I answer your question?
Yes, you did. Yes, you did. I actually love some of the things that you were bringing up because the biggest question I actually want to ask you, Cole, I think that some people need to kind of really understand and consider is if someone is taking medication without training alongside of it, what risk are they facing?
If they're taking a medication without training alongside it, I mean, they're risking a quality of life decrease over time with respect to the muscle wasting effect. Now, the doctor is going to ensure that that's not going to happen as best as possible. But because of there's a specific amino acid that is typically implicated in muscle gain, which is the leucine amino acid. This particular amino acid, we have a number of different amino acids in our body, but this particular one is found in high quantities in things like chicken and other things. But this particular leucine amino acid, whenever our body senses a certain amount of it, it turns on the mTOR pathway, which is a biochemical pathway that creates muscle synthesis. If we're not getting enough protein at all, we're not going to see muscle synthesis in the first place. And so if you are the other route of muscle synthesis is creating that tension I discussed earlier. So if you are not getting one of them and then the other one is limited, then we're sort of setting ourselves up for not age-related sarcopenia, but accelerated sarcopenia in the future. And almost certainly so many of the situations that we find ourselves in at senior ages, or some of the quality of life problems that we have for people in senior homes, senior living communities, is that the inability to be able to walk unassisted, or to be able to have high, or to be able to survive falling rates because of osteopenia. All of that is affected by strength training. And so we see massive, massive implications across time. So we might not see that implication right now while someone's 30, 40 years old. But if that goes unchecked over the course of years or decades, we will start seeing major problems in the healthcare systems that they're going to encounter later.
Great. Thank you so much for sharing that, Cole. That was extremely informative, everyone. We're actually going to be moving into our open Q&A next. I'll kind of start off by asking some questions, just kind of generally to the group. If anyone watching has any specific questions, please feel free to enter them into the chat. You can kind of specify it for the group or for an individual as well. And from there, I'll actually want to start off with the question to the entire panel. But where do you feel the biggest disconnect is between medicine, nutrition, and fitness in regards to GLP-1s? Anyone can just jump into as well.
So the biggest disconnect between those three?
Yeah.
I mean, I think from the patient perspective, it would just be thinking that one of those silos is going to help them get the results that they are looking for. It really, it all has to work together. And when I'm working with my patients, I do like to focus on small, specific, realistic goals, maybe 1 to 3 at a time, goals at a time, not overwhelming them. So I might start with one area, but the next area is going to bring in, or the next set of goals is going to bring in the fitness aspect, doing more screenings with the doctor, making sure that we are looking at, the overall health of a person and not just thinking that one of these silos is going to help you get to your goal, or to just give you overall wellness.
Awesome. Thank you. Thank you, Jessica.
And I would add to that, just not viewing the medication as the medication is going to do everything by itself, right? Which lends to the whole point is they need, like Jessica was saying, they need all the different components. And I totally understand that integrating all these components at the same time can be overwhelming. So they kind of do it stepwise. But these meds all work better if you're doing everything. And they're all studied in the context of everybody doing everything, which again is really hard in real life. But even doing a little bit in each little arena is going to help. So I agree. It should be a stepwise approach, meeting them where they are and what they're ready to do at one point, but realizing it's sort of not the like, oh, I just take this and everything gets better immediately. It helps a lot though. I mean, to be frank, but yeah.
Yeah, cool.
I think one thing that you all are doing a good job of mentioning is the idea that it is just another tool in the toolbox. It isn't something that should be taken or experienced with shame, or seen in any way. I think that in terms of hurdles or disconnects, it is the either source of misinformation or those feelings of shame surrounding medications that do help and that people have utilized with great effect. And for some people, it just doesn't work, and we'll find a different option, a different tool. But it's the idea that it is just another thing that can help, and that there shouldn't be any shame around it. And it's certainly in the fitness field, there's a lot of shame around body composition in the first place, and so adding that extra layer of it can mean it is that much more shameful. Like, oh, I need a trainer, and I also need these things. No, it's
correct.
We need all of these things because that's just what's required.
Yeah.
Great. Thank you all. We got a question in chat from Elaine. She says, I've heard friends talk about microdosing to maintain a lower desired weight. Is that healthy?
I mean, so microdosing in the sense of people who don't need it in the first place or don't want to take a normal dose.
We'll see if Elaine clarifies a bit more on that. But let's just assume but let's assume Renu that like I guess
Mhm.
like taking smaller doses.
Smaller doses. Yeah. So the funny thing is this whole idea of microdosing is kind of interesting to me. Um, you know, I think it's just a matter of like what dose works for somebody, right? And if I have somebody who comes to me and says, look, I'm super sensitive to medications just generally, or, I'm really afraid of side effects or whatever, I'm going to start them on a smaller dose. I might even start them on a smaller dose than is supposed to be started with. Like I might start them on half the dose one or whatever, just to be judicious and sort of say, okay, well, sure, that's great. Let's, that smaller doses reduce side effects. They also might have less efficacy, but obviously I'd rather start small and build up from there as the patient tolerates the medication. I also go a little bit outside the box in this, and this is why I think it's really important to find a provider, frankly, that really understands these medications and uses them, frankly, frequently and has a lot of patients on them. So they really kind of, for lack of a better thing, know what they're doing. Because I have found it, and it's no judgment because the good news is these medications are widely available and are being reached, to more people are able to access them now. Insurance is a whole nother separate question, but in theory, people are able to access them more, and the more providers that prescribe them, the better, just for the health of the country. However, if you just go by the label and just automatically like bump up the dose monthly as these meds are studied, it can get some people in a lot of trouble and make them feel terrible, and they didn't need to feel terrible, right? So the idea of using lower doses just generally and not necessarily automatically escalating doses is something I do all the time, sort of thing. So yeah, I truly believe, yes, they can be really effective in smaller doses.
All right. All right. Thank you, Renu. We got another question in from Richard, who actually is asking two questions here. Using GLP-1s as a pre-diabetic, is there value to taking it to lower A1C counts and lose weight, but not have an end to taking the medication? And second question, what have you seen with patients who have stopped taking the medication as well?
Um, so as far as the ending the use of the medication, this is a medication. This is a question we get frequently. Officially, again, according to FDA approval, these medications are approved for long-term use because the mentality around this is you're treating a chronic medical condition, right? When someone takes a blood pressure medication and their blood pressure becomes better or normal, you don't stop the medication and take it away, right? Expecting their blood pressure to continue to be normal. You continue the medication. But somehow with this sort of problem, because I think in the past people have said, oh, I'm supposed to diet and then bring my weight down, or exercise a lot and bring my weight down, and then it's just never going to be a problem again. Unfortunately, that's just not the reality because it's a biologically based problem, again, with multiple factors. The idea is it's like you're managing a chronic condition, and you may have years where it's going great and years where it kind of gets a little out of hand and not where you would like it. And so the concept is that these meds are safe to take long term. And usually the in most of the studies, it's that you max out at the max dose that works for you. Even on the max dose, you're going to lose weight and then start maintaining. No one's going to lose weight forever on any medication. Your body will reset at a particular set point. And then what the studies and that frankly the drug companies would say is that you just continue at whatever that dose was. There are many ongoing studies right now to answer this very question. What should someone do at maintenance? Should they stay on the same dose? Should they go on a lower dose? Should they go on a lower dose or the same dose but take it less frequently? I would say of my patients, all of the above are happening. Like I have discussions with them, and everyone we come to an idea of what we want to try together in terms of the maintenance phase. As far as people stopping the medication, usually the scenario, I would say the most common scenario, is that they are able to maintain their weight for a while. And they're still, of course, trying to do all the lifestyle things we've talked about. But some, more often than not, sometimes there's exceptions, but more often than not, within a few months, people start regaining their weight and get a little nervous and go back on a medication. That's sort of the most common scenario.
Great. Thanks for answering those questions, Renu. Next question actually is for Jessica. We got this from someone who registered for the event. They ask, what does a well-balanced day of eating realistically look like for someone on a GLP-1?
Yeah, that's a great question. It will vary from person to person, so I will say that first and foremost. But starting, some people find in the morning they experience a little bit more nausea than later in the day. So I do recommend. I have some patients that they have a little bit of applesauce first thing in the morning to just kind of settle their stomach a little bit before kind of going into a meal. But I do recommend trying to eat something within the first, 2 hours of waking up. Start with some water to start rehydrating from our natural overnight fasting. And then, eating, meals are going to be protein focused, include fiber and healthy fats. So, for example, breakfast could be like a plain or unsweetened Greek yogurt with berries and chia seeds and a drizzle of honey on top. Um, Lunch could be chicken breast with quinoa and roasted vegetables and, like a vinaigrette dressing. Um, you know, I do recommend eating every couple of hours so that we don't go for too long of periods of time. And then you can actually kind of have a little bit of smaller meals that way, but spread the food out a little bit easier. So a mid-afternoon snack is also helpful. A smoothie is a great thing to have in there. Some fruit and some nuts would be a really easy option as well. And then dinner would, again, be protein. Like salmon is a really nice protein option, omega-3 fatty acids, which are great to help decrease inflammation. Um, Roasted sweet potato has potassium, beta carotene, and fiber, and then maybe some like sauteed spinach to get that extra dose of vitamin C in there. Really focusing, making sure each meal has the protein, fiber, and healthy fats. As far as portion sizes, especially when they're first getting onto these GLP-1s, the portions may be smaller, but I do recommend trying to get these nutrients in at meals as much as possible. And for some people, they might find that they're really good with chicken, but every other protein just isn't working for them right now. And that's okay to repeat foods if that is helping you kind of feel better from a digestive perspective.
Great. Thanks so much, Jessica, for sharing and being able to answer that question. I actually want to go back to Elaine's question that we had previously, as she kind of expounded upon what she first asked, but she actually meant someone who may not need it on a medical basis, which actually is a question that we did get in the chat, sorry, in the registration that someone signed up for too as well. But for you, Renu, how do you address someone who comes to you, or you finding out someone who is taking a GLP-1 who may not necessarily need to be taking it?
So I think that's a great question. So I think the question there is sort of, well, why, right? Why do they feel like they need this medication, right? Because yes, obviously, these meds are FDA approved for a certain BMI, or a BMI of 27, and then you have to have another problem that's usually related to weight, like high blood pressure or diabetes or something with it, or obviously if you're diabetic. So there's certain criterion. But really, what is making, it's kind of, you have to take a couple steps back psychologically, frankly, like what is making them feel like they need this medication? Now, what's interesting is there are people, and again, it's a nuanced thing, and that's why you have to have a really good relationship with your provider, but there are some people who have a lot of food noise that causes a lot of anxiety, even if they're not overweight, right? And so they actually might benefit perhaps from that little perspective from using a small dose of a GLP-1, or frankly, another medication for weight management, that we have others that also help with food noise. But an anxiety medication may also help with food. So it really involves a really detailed discussion with somebody and with a really trusted provider, whether it's your primary care provider, whether it's a psychologist, whether it's a psychiatrist or internist, or myself, someone like, who specializes in this. But in terms of what's the why. Now, it is frustrating, I know, in the lay community when people are like, oh, well, I just want to go on a GLP-1 to lose, 5 pounds for a wedding, right? That's often a scenario that you need. And I think, it's tough. Like, I try to be I'm never going to judge anybody, because clearly that's something that they feel stress about and want to look better, whatever that means for them. But they have to understand that there's perhaps other ways in which they might be able to achieve that goal. Or if not, they're just using these meds, again, can be very risky, right? There are real significant potential side effects of these meds, which actually, and these meds I will consider, although as effective as they also are the risk benefit. There are low risks, but low risks of really bad things can happen, right? Pancreatitis is one. It's a really bad, inflammation of your body. You can get a gallstone, need your gallbladder out. There's a lot of really bad things that could happen. Again, low risk, but is it really worth that risk? And might there be some other way to address this, even with another medication that might be much more benign or whatever? But again, it's a matter of having a really good conversation with your provider.
Thanks for answering that, Renu. I actually want to tie this into you too, Jessica, as well. How is it in your case if someone starts taking the GLP-1 and in your professional opinion, they may not need to be taking it?
Yeah. I leave medication prescribing to the doctor's choice. So, whatever the doctor is prescribing, recommending, I will follow through with that. But yeah, if they don't have that much weight to lose, I'm going to make sure we're really focusing on getting the nutrients in, not skipping the meals, and nourishing them as much as possible so that any weight that they do lose really is whatever body fat they've got to lose, and that they are keeping those muscles nice and strong, both from a metabolic standpoint, from a bone health standpoint, and just from a strength standpoint.
Great. Thanks for being able to follow up on that from the nutritionist perspective too. For our next question, another question from someone who registered. This one actually is for Cole. But if someone is new to both fitness and GLP-1s, what are the first few things that you really focus on to set them up for success?
Yeah, I think that someone who's new to fitness, regardless of whether or not they're on GLP-1s, is going to be a similar case. So as far as what we like to focus on, it is anchoring into the basics, the skill acquisition of the movement patterns that we're going to use to get you towards your goals. So there is this sort of, we call it a general preparatory phase, which we return to consistently, but it is this period of training where we are focused on high volume, so a skill acquisition through repetition. And it's essentially a practice makes permanent kind of, or a practice makes habitual sort of situation where we're doing a lot of repetitions. We're really hammering in the movement patterns. We're hammering in the habit, making sure that something is sustainable, and then sort of figuring out where your limits are. And once we know where the limits are, we're going to push against them gently, consistently for as long as we'll have you, or as long as you'll have us. And so that's very generically, that's where we start. More specifically, where we're going to start is we anchor all of our concepts into the sports science of strength and conditioning. And we can take a lot from how we modify training at the highest level and put it towards people who are operating, getting directly off of being sedentary for many years or off of injuries or anything like that. And so we can apply these concepts at every single scale. And the very first thing we start off with is, can you squat? If not, how can we get you to squat in some form that is meaningful in a way that we can begin to load you? Once we're capable of loading the muscles in any meaningful fashion, regardless of whether it's a squat or a deadlift or a bench press or just carrying something somewhat heavy, then we just move forward from there. So it's really about range finding. It's about finding what exactly your limit is supposed to be at this current moment and consistently pushing against it.
Awesome. Thank you. Thank you, Cole. Yeah, I want to thank the panel so far for all the questions that they've been able to answer. We're starting to approach the end of our webinar session for tonight. I wanted to kind of give everyone the opportunity to what I call like a plug. If you guys want to tell the audience a bit more about your once again your background, where you are located, and kind of what your specialty is again. Jessica, I'll start with you to help us close things off.
Yeah, so I see my patients virtually through a HIPAA compliant platform, Tuesday through Friday. And, specialties, everything from, sports training to weight loss to diabetes, heart health, food allergies, digestion. So, kind of the gamut, basically working with adults. I don't work with children. I have great referrals that I, though, can send my younger patients over to. And you can find me at www.jessicaganzer.com, and all of my information is there on how to connect with me.
Awesome. Thanks so much, Jessica. I would also say I will send an email following up to everyone who registered with all the panelists' information as well too. Cole, I will have you go next, sir.
Yeah, so for those of you who are not Method Fitness clients and happen to be in the DMV area, we're located in Arlington. We have 2 locations. We have a location for private training, which is the one that I'm the fitness director of. And we also have a second location for semi-private training that's a bit more of a group feel, but it is still 6-person classes, and our coaches are capable of managing a personal feel while simultaneously running a busy fitness class. So we have 2 different styles, and you might see more of us in the future across the different locations or across different cities. So hopefully that's something that we'll be able to expand to if you're not in the area. But yeah, so if you're interested in coming through, we do free consultations at both. We do free classes at M2. Again, all of it is scalable. All of it is personable or personalized. But you can expect to do very similar things as I outlined. Like I said, our needs vary in magnitude, not in kind. So if you're starting just getting off the couch today, if you're starting and you're looking to improve your time in a marathon or something like that, we can work everything in between. We're happy to help, and we love working with anybody who wants to walk in the door.
Thank you so much, Cole. And I'll finally have Renu speak, please.
Sure. Yeah, so again, my name is Renu Mansukhani. People call me Dr. M. I am an endocrinologist and obesity medicine specialist. My office is located in Fairfax and kind of the Merrifield area in Virginia. I do see my mandate is that I have to see you in person first, but after that, appointments can be done virtually. But I do mandate that you come in at least one time a year in person. I do have a pretty sophisticated body composition machine in my office. So some people like to come in just to do that so that they can, find out, are they losing muscle? Are they losing fat? That sort of thing. Again, I have a pretty holistic approach. My website is called Patient-Centered Weight Management. So it's P like Paul, C like cat, pcweight.com. Feel free to look me up. I am, to be honest, pretty full. However, I always love to help anybody who needs advice on any front. So if you need another provider, I could, see you just for an initial consult, just to point in a direction. I also do a free consult to, for people to, if you just want to kind of just bounce, something off of me, to say what direction you should go in. But again, I really like helping people in a holistic way.
Awesome. Thank you guys so much for your time tonight to just speak to the community. This will be shared on the Method website and to either one of the panelists who would love to share to their patients as well. Thank you all so much for your time. Panelists, please stay on as people are logging off. Thank you so much.
Thank you.
Bye, everyone.
Thank you.
Yeah, great work, Aiden. Nice job. Thank you.
Thank you, Cole. Thank you. As you guys are getting all the love in the chat.
Excellent. Oh, Nikki, I think you're muted.
Is she still muted?
Oh, this was fabulous. Thank you very much.
Thanks for joining.
You're welcome.
Thanks for joining.
You're welcome, Mom. You're
Thanks.
welcome, Mom.
I love that so much. That's great.
Thank you.
That's awesome.
All right, cool. All right, panelists, how are you feeling?
Good. That was fun.
Yeah, that was fun.
That's great. Good
And Aiden,
questions. Good
your questions were
conversation.
great, Aiden. Your questions were really, you're a great moderator. Absolutely.
Awesome. Thanks.
Yeah.
Yeah, I was trying to like give everyone like equal time and space, kind of asking questions here and
Yeah.
there too. So no,
Mhm.
you all did wonderful. That was awesome, guys. That was really cool.
Mhm.
I learned a lot. That was a really cool time, and I really appreciated it. Can all of you do me a favor? Cole, you don't have to because I have your information all already. But can you send me like your websites, emails, things in that regard, so I can kind of share it with everyone who registered. Like I said, this would be recorded, so I would make sure to edit it and kind of send it to whoever, so we can post it on our website so anyone can watch it too. Cool.
Sounds good.
Fantastic. Yep.
That'll be
All right.
great.
All right, guys. Well,
Thank you so much.
have a
Thank
good rest of
you.
your night. It is late. Get some rest, okay?
Okay. Have a
Thank
good
you,
night.
guys. Have a good
Thanks.
night.
All
See ya.
right. Okay.
Bye.
Bye.